Morning, everyone. I'd like to welcome you to the Global Health Impact Network podcast series. And our guest today is Lee Plant Mason, and we'll give Lee a chance to introduce himself here shortly, who is a very active participant in our network and an emergency room physician. And today we're going to be talking about men's health with a focus a bit on longevity. I'd just like to take a moment to briefly introduce the network. So Global Health Impact Network has been around for close to 7 years now. And the mission and vision of the network has been from day one. And by the way, I'm the founder and the CEO of the network, is we looking to provide an ecosystem and an opportunity for clinicians, health professionals, to actively participate in the digital health evolving revolution. I personally had an experience as a physician informaticist for a 27 hospital system to be consulting around the country for Epic implementations. And everywhere I went, our colleagues were all disenfranchised and unhappy about how a lot of the technology that was being released for our use in clinical practice lacked a sense of input from the actual clinicians that were going to be using the technology. So the network was created to really provide an easy place for collaboration, communication, education focused on innovation in healthcare. And members are essentially anyone who's a professional who's interested in promoting healthcare, with a very heavy focus on clinicians, of course. So, Lee, let me give you a chance to introduce yourself, and then I'll introduce myself.
Sure, sounds great. So my name's Lee Plant Mason. I'm an active clinician, academic. I work down in Los Angeles. I actually came on the network about 5.5, almost 6 years now, when the first fund was coming around. I initially had heard about my specific interest was in Lucent and Radian just because I thought they were having some pretty groundbreaking technology in terms of the way we manage both cardiovascular disease and also prenatal and postnatal care. Um, so like I said, I'm now a VP with GHIF now for the last few years. We're kind of working on our second fund and looking to expand. I'm still, like I said, full-time clinician, academic. I do quite a bit of research, specifically like in critical care and ECMO, and also quite a bit of like social kind of interventions with social medicine, things like that.
Great, thank you.
Mhm.
I'm Gary Goldman. As everybody can see, you've got a bunch of letters after my name. You know, I've been 35 years in healthcare, wore pretty much every operator hat there is to wear as a clinician, as an administrator, as a serial entrepreneur, and as a physician informaticist, and now the founder and CEO of Global Health Impact Network and the managing partner for Global Health Impact Funds. And as I mentioned, so we are a clinician-driven organization focused on innovation, with, again, mission and vision to promote active participation by health professionals in this evolving digital health revolution. As Lee mentioned, the fund and our network are separate entities, but collaborate very closely. The fund gives the health professionals an opportunity to participate in every aspect of selecting the companies, with the idea of creating a network of clinicians that could identify early stage market disruptive technologies from the clinician's perspective, gives them a chance to actively invest through a venture fund, which is a kind of an unusual model. And then the network provides all the resources for to support companies from everything from early idea generation through commercialization and exit. And it's an opportunity for the members of the network. Not everyone is going to be an investor. We have several thousand clinicians, but only a small number have the opportunity to invest because of SEC rules and regulations in terms of the numbers that can invest in a fund. But at the end of the day, they all play an active role in the due diligence and then post due diligence investment facilitation of the companies, our network has over 400 communities that are there to support the needs of the individual members and the companies that are in the network and our strategic partners. So today we're going to be talking, as we talked about men's health. So, at the end of the day, men's health is a fairly 100,000-foot concept, which involves many aspects of clinical care. Um, but at the end of the day, I think, one would say that the primary goal is to optimize health for the individual over the lifetime and extending the lifespan of an individual by leveraging all of the innovation that's coming out. So, for Lee, for you, how do you define, from a men's health perspective, longevity?
I think if you think of health, health has come this kind of complex symbiosis of physical, emotional, environmental conditions and interactions. I think being able to optimize all those things is important. As we get older, we have the effects of aging. We have hypertension. We get diabetes. We get arthritis. All these other things that kind of limit our functions. And being able to kind of optimize your care, not just for like living long, but living well. So be 80 and moving, and be 80 and be interactive in your community, be interacting with your family, be happy, productive person. Those are all really important for our physical, our emotional, our physical health, and they all interact very, very seamlessly. I think the areas where we can really intervene on in the terms of technology are, how can we get better medication adherence? How can we improve telehealth? How can we have wearables to actually monitor people's health? A lot of the kind of social and architectural stuff, like we can't fix. We can't fix social capital all the time. We can't always fix the way people get around and access to care, but we can ideally optimize their access through other means. And that, we have quite a few exciting innovations that are coming out right now regarding just wearable technology, or with the way we monitor chronic conditions to optimize those conditions, so people aren't in the hospital every 30 to 60 days. So it's actually fairly exciting right now because there's so much innovation. There's, especially with changes with machine learning and kind of artificial intelligence, that we monitor these things in ways we can identify relationships that we never really knew existed in the past.
Yeah, thank you. And I think, from my perspective, and I always tend to take, more of from an innovation perspective, as you mentioned, a lot of the technology that's coming out. We live in an exciting time right now, in that, uh, you know, the volume of medical knowledge in itself, with all the research that's being done, with all the data that's being collected by every 78 days, which is because how do you manage all of that information and all of that data? And, to focus back in on the network. So what are we doing about that? Well, as I mentioned, we have over 400 communities. So what we do is we create a community within our proprietary network platform, which is focused in on longevity. And as you might imagine, longevity in men's health cuts across many specialties, as Lee, you alluded to. So there's longevity in cardiology from a cardiology perspective. There's longevity, from a urology perspective. You could pick all the different specialties and professions and probably focus in on it. So what our network does is it brings in those clinicians that are part of our network in a targeted way, who are subject matter experts in those areas, with the idea of providing resources for them to be better clinicians, resources to educate themselves on the existing technology that's coming out. And then at the end of the day, we do have a venture fund. We're also focusing in on exploring what's out there and identifying through due diligence what we believe are the most market disruptive technologies in this space. We will then ultimately either invest in them and facilitate them in the network, either or both. And we bring in these subject matter experts to kind of assist the companies as they grow and scale. So that's how the Global Health Impact Network and Fund work together in a space like this. So Lee, from your medical experience, like, what are some of the most preventable causes of early death in men today that probably aren't being addressed as well as we would like, but what's coming down the pike in terms of technology?
I think the kind of the big ones right now, one is mental health. I think there's been a 50% increase in middle-aged men suicide from men from like 45 to 60s jumped like 50% in the last 3 to 4 years. I think men that are over 50 are the most successful at suicide. So mental health is a huge part of it. So access to care, getting engaged with care. There's just not enough mental health providers. So like engaging through telehealth, other kind of media to be able to access that kind of technology and then have exposure to the people who can actually manage these kind of conditions. Cardiovascular health is a huge one too. We're getting heavier. We need more medications. There's lack of access to healthy food and safe places to walk and get exercise. So getting people to move, getting people outside, getting people exposure to the sun, get some vitamin D, walk around, move, but then also adherence to medications, like taking your blood pressure medications. Medical adherence is a huge problem. Getting access to medications, so that could be like getting medication sent to you, having new trackers that actually monitor your kind of fluid status if you have congestive heart failure. There's all kinds of innovations that are coming out that are kind of ripe to improve this process, whether it's medication adherence or even just the way the medications work. So there's new smart medications that actually track how you take the medications. Are you responding to the medications, things like that, so we can change our doses as clinicians so you can optimize care, but then also improve health outcomes. Sleep is another big one. So we live in a society where things don't turn off. We are on social media. There's always lights on. So sleep is really important. Obstructive sleep apnea is huge. So there's new trackers of being able to monitor people's sleep, wearable devices. But that's helpful in the sense that we can actually capture the people who are the kind of atypical patients. Not always like the very heavy patient, but there's people that have kind of anatomic changes. There's certain patient populations that are much more at risk for having severe obstructive sleep apnea, which leads to pulmonary and cardiovascular issues down the line.
Great. Yeah, and again, getting back, to looking at it from the innovation perspective for, our audience is, a good portion of our audience are the actual clinicians caring for these patients. And as you point out from a mental health perspective, even within our profession, there's a huge amount of burnout, right?
Yeah,
There's a lot
absolutely.
going on. As we alluded to, it's harder and harder to be an excellent clinician and have a knowledge base of all of the literature that's coming out, the scientific evidence-based medicine. But the good side of that is there's a lot of technology coming out because of machine learning, and I'm not a big fan of the word artificial intelligence, but assisted intelligence. So there's a lot coming out which is assisting the clinicians in providing better care to their patients by being able to track the data in a way, giving them some feedback with, again, assisted intelligence, helping a clinician work with a patient to look at their phenotypic data, everything that's flooding, their vital signs, their laboratory tests, all of those things, the supplements that they're taking, and tracking it in a single place and making it available not just for the patient, but for the clinician as well, and then assisting the clinicians when there are problems. The other part of it is, the sick care versus preventative, and I'd love to talk about that briefly. Our system, is a little bit broken in that we provide a lot of sick care. We wait till people get
Mhm.
sick, and then that's when they come to the doctor and or the clinician and seek care. But what about the preventive side of it? From your perspective? You're talking about you've talked about the devices that are out there and the tracking. How do we use that technology as busy clinicians who don't have a lot of time to spend with every single patient, but want our patients, as you point out, to be compliant with the medications and the treatments that they have, but also lifestyle? How do we help them be better individuals to prevent disease and improve their longevity?
Well, I think the beauty of it now is there's this kind of interaction where it's actually getting rolled into certain insurance repayments. So like as you get reimbursed for your care replacement of your patient, excuse me, is that when you get these patient trackers, you get these metrics, they'll actually go into the EHR now. So you can track them and it becomes a metric that's get associated with your reimbursement. So it gets bundled into care. So ideally, just because as medical reimbursements go down, we get paid less and less. We have more and more debt from medical school. There's this inverse relationship where less and less people are going to go into medicine. And so it's really important to be able to kind of optimize that. So, you one, it's better for the patient, but then two is that you're actually getting reimbursed for the care that you do. And over time, that's become less and less. And so it's a little bit harder, especially folks that are in primary care. So pediatrics, family medicine, internal medicine, there's less and less reimbursement. And so it's hard for these folks to kind of get by when you're paying your medical school bills. And so there needs to be a better way that we can promote kind of preventative care and just healthy lifestyles. And so the integration with the EHRs, it also just for the patient itself is they can give them kind of gentle reminders, whether it's a ping on their phone or their iWatch or something else, just to remind them to be like, oh, take your 20-minute walk today, or did you have your 5 glasses of water? Did you go outside and get some just gentle sun exposure? Did you interact with your neighbor? Things like that are actually really important just for kind of social cohesion in your own physical health. But if that gets rolled into the bundling of these processes and these payments into the EHRs, that it's not the doctor that has to do that kind of like work. Like you shouldn't have to just do that inputting all the time. That's the biggest burnout problem. Is like the EHRs are a pain and they're annoying and there's lots of clicks. When you have paper charts, it's like you write down a couple lines and you get the care taken care of. But now it's like a lot of your reimbursement is based off of statements that you make, and it's automatically rolled into EHR that gets auto populated, which minimizes the time the doctor's sitting in front of the computer actually helping the patient.
Yeah, and also, as we both know, there's a lot of technology that we're looking at in the network, from a generative and an agentic AI perspective, which is coming out helping clinicians and helping patients with that because it's acting kind of like your sidekick, right, on your shoulder,
Yeah,
and it's looking at everything that you're doing on a daily basis. We all have our iWatches and we have our, Samsung watches and we have all these devices and we're constantly feeding all this data into some server somewhere. And now that we have a lot of this technology being developed, which is constantly looking at that and nudging you when there's a problem and encouraging you when you're doing the right things, which makes it a lot easier for the clinicians to kind of address those early signs, the risk markers, and have patients pay more attention to that because they're getting constant reminders. So that's a very exciting time also. And it's a really great opportunity for us as clinicians who happen to be working in the innovation space to really facilitate that. When you look at men's health, I mean, you can go down the list. There's the sexual health, which, tends
yeah,
to be at the top of the list for a lot of patients and a lot of clinicians. And that involves hormones and laboratory tests and biomarkers. And then there's a lot of technology coming out that happens to be digital in nature, which can help with the sexual health. And then, of course, there's the Rose and the Hims and the Hers. All of these companies that are coming out now that are making it much easier for patients and clinicians to address these, have access to the appropriate
yeah.
scientific evidence-based medications, all of that, which is very exciting. As we grow in this space. So
Yeah. And I think that's also important, just having that clinician physician input, just because our jobs are essentially like applied scientists. We see, different presentations of various conditions, and then how that manifests is really important. Is what you don't pick up being a non-clinician. You don't see those nuances. You don't see the kind of other structural factors that go into any complications, medications, and kind of secondary sequelae of people getting sicker. And so that's really important that we have this physician network, so that people can actually provide their input and be like, well, I've had this experience and this is where my bottleneck is. How can we fix this bottleneck? And kind of fixing those speed bumps and those areas of inertia, or those are the kind of nuggets that we want to try and fix and that we can take advantage of.
Yeah, and the other thing that's interesting too, I'd love your perspective on it, is, there's a lot of granularity in care and solutions. You go to like a HIMSS conference and there's a football field where the companies, everybody's working
Yeah,
on some aspect of care provision or tracking or, long-term monitoring of patients. But it's very difficult when there's 27 different apps
Right.
that you could use to kind of help yourself take care of patients, or as a clinician to provide care for patients. But one of the nice things, that I'm seeing, that we're both seeing, that's happening, is what's popping up is there's a lot of clinician-driven solutions out there, like longevity MDs, and
Yeah.
there's companies like Function Health that are looking at just the laboratory aspect of longevity and men's health. Um, and they're pulling it together in a way which makes it a lot easier for the whole care team, including the patient, to track it in one place, and have some interoperability, which is another big key word that we always deal with clinicians with the electronic healthcare records. Everything has to talk to each other, otherwise it
Yeah.
just becomes very inefficient and effective. So, what are some of your thoughts about that?
Well, I think that's the beauty of, like, as things are evolving, there's more machine learning, more kind of AI type innovations, that I think we're going to be one of the few fields where it'll actually be a symbiotic relationship. It's not going to be a replacement. It's like we have to have the human component, but like it can make us better. It can make us more efficient. It can give us more time in front of the patient. And so I think like we're one of the few fields where like our job is less likely to be in jeopardy, because it'll be more of an assistive kind of partner that runs with you, whether it's knowledge based, whether it's application based, whether it's adherence based for your patient care. I think we're really lucky in that sense, is that it's going to be this like symbiotic kind of parallel relationship where it's going to grow together. And I think that if it's physician guided, it's going to be even more optimized, rather than having some of these technologies which sound great, but the application is a little bit dysfunctional.
Great. Let's take it in a little bit different direction too, in terms of, I've always liked the concept not to just uh, talk the talk, but walk the walk as well, right?
Yeah.
So for clinicians, who have to be, or should be, motivating for their patients, I've always laughed about this over the years. It's hard to take seriously from a patient's perspective when you walk in the door to your cardiologist, and your cardiologist is morbidly obese or way overweight, and they're smoking a cigarette, and here they're telling you to
Yeah, it
do
smells like
everything
Marlboro
that they
Reds.
don't do. Right,
Right.
exactly. And it's all joking aside, it's a serious component. So, it's also walking the walk. And I'll talk a little bit about, for me, I've spent a lifetime, kind of crazy, frankly. I've done 3 Ironman races, and I take every supplement known to man, of course, after researching them. But there's not, scientific evidence-based medicine for everything that's out there, but there's prompts, right? Sometimes
Yeah.
something works, but we don't know why it works. Well, as long as it's working and there's evidence of it, then you want to do that. So, it's important for us as clinicians to be walking the walk. So, like for yourself, like when you look at all this, from your perspective, personally as a patient and as a clinician dealing with patients, what are you doing yourself that kind of walks the walk?
I mean, I think I'm kind of lucky in the sense I was always an athlete as a kid. Played football, I wrestled, pretty much all these sports most all my life. I was a Golden Gloves boxer when I was younger, so there's always something of like, there's always that physicality, and so that neural patterns are always kind of set of where like if I don't do it, I feel off.
Mhm.
Something is screwed up when I don't do it. So I get more achy, I get more irritable, I kind of sleep like crap. So there's like always something up. I get some kind of like physiologic trigger, be like, oh, you need to do something. I mean, the problem is like just with being a parent and busy clinician and just the 10,000 things we have going on is like kind of fitting that time in. So usually it's just lots of hydration, trying to get good kind of sleep. I'll probably exercise 6 or 7 times a week, just something, whether it's just running 5 miles or lifting weights, whatever, just something. And interesting is that, I use my father-in-law as an example. So he did construction his entire life, retired in the 60s and started running half Ironmans at age 70. So like the turnaround, the pivot you can make up into your 70s is pretty amazing. So now the guy runs marathons all the time and does, these half Ironmans all over the country and internationally now at like 74 years old. So like the transition you can make and the pivots you can make are pretty amazing at any age. I'm in my late 40s now. So those little kind of small little things are changing now. The sore knees, the sore shoulders, the sore neck from all, getting beat up in sports for so long. And now that accumulation of those injuries starting to kink. So like I've definitely had to adapt the stuff that I do. But I think it's just the persistence is the most important, just kind of creating those neural patterns. So you just have something that you do every single day.
Yeah, and it brings up another, interesting point from a lifestyle perspective. None of us, all of us walk around with this, the little device in our hands, and right, half the people across what looking at it while they cross the street. So, I always
Right.
talk about the fact that, it's great to do all the right things, but you also don't want to get hit by a bus. So you got to pay attention to what you're doing with
Right.
all these devices, not be distracted. So, but you look at what's available, as apps on phones, apps on, iPads, or or any kind of pad technology. There are exercise classes, there's Peloton, there's so much access in a very inexpensive way in many cases, to programs that help with yoga, that help with sleep
Mhm.
processes, and they have educational information, they have tracking information. So it's really, there's for me, it's hard to make an excuse when someone wants to do it but doesn't, when all this technology is out there. But from your perspective, does having it can be a distraction, but it can also be incredibly supportive and educational. Do you think that these apps and all this technology that's coming out, is something that really will help us change the focus on a lot of this preventive care and ongoing sick care?
I think so. Just because, structurally things aren't going to change the way our society is kind of built. And so I think the way we integrate is probably going to be most important. So it's like, as for patient side, or for myself, it's having those nudges to be of like, oh, did you take your meds? Did you do your exercise today? Did you get your 3 meals? Did you make your own meals? Try not to buy your own food, make your own food. Um, and then, for that kind of auxiliary care, so if it's mental health related stuff, is having access to care. I mean, there's new mental health apps that kind of track people's moods, people's sleep. All
Hmm.
these things are affected with mental health changes, and so being able to kind of pick up on those cues and just for your own kind of self awareness is really important, because you can really only try and pursue care if you actually identify what the problem is. If you don't identify what the problem is, we're great at trying to brushing things under the carpet to pretend like it doesn't exist. But sometimes those little nudges give us a little bit of a kind of a neural kick to be like, hey, there's something going on, and maybe you should address it. So I think it's kind of a nice way, just to have a feedback mechanism. So like we're distracted in so many ways in modern society, and so it's a nice way just to be like, hey, just take some time for yourself, and make sure you address these things also. And if it's a reminder on your phone, or it's a reminder on your watch, or it's a reminder for your physician too, if they're tracking these things, like your sleep patterns, your heart rate. If you have AFib and you're not taking your meds and your heart rate's 130 all the time, be like, hey, make sure you double your dose, or come in and get checks, and maybe you need to do medication reconciliation, something like that. So I think that integration is going to be really important. It's also um, going to improve our health over the long term.
Yeah, and I think it's also fascinating too. When I'm constantly giving talks, on the topic of innovation, and you kind of you look at it, and there's a lot out there, at our access, but at the end of the day, um, you look at it, I certainly, I'm almost 70, and we didn't have any of this, and when you were still expected to do a lot of this, but now, having the technology at your fingertips. I always joke that, of course, the pandemic was a horrible thing, but one of the best things that came out of the pandemic for us as clinicians and patients is digital health, because
Yeah, absolutely.
now it's allowed us, through telehealth, through all this technology, to be able to deliver care to the point of care, the patient, wherever they are, on this little device that we have. And, I mean, now there are, adapters for ultrasound, and, a lot of even interventional or, procedural care can be accomplished leveraging a little bit of, a lot of this technology as well. And, it brings up the concept of health equity. right? Because
Yeah.
not everybody has access to a clinician physically. People live in areas that, don't have access, and they may have to travel 20, 50 miles to get to a hospital or to a local doctor. But now, as you point out, even, from the areas of mental health, radiology, there's ways to get access to a lot of this information, no matter where you are as a patient, as a provider, as some sort of extender at the point of care. So we're delivering better care, men's health, women's health, in the most remote places of the world. And you and I see this all the time. Many of the
Mhm.
companies that we are investing in, we're looking at them deploying it, of course, in first world arenas, but the most important part, and that's why we have, right, social as part of the, impact as part of the name of our network, is the focus of helping these companies and these solutions delivered to the most remote places. I
Yeah.
mean, you're very well aware we're extending now our network into Africa and India, and places where they would not even have access to care. There are extenders that are getting into Jeeps with digital health monitoring
Yeah.
briefcases and devices, and bringing it to the most remote villages. So it's very exciting that way, from that perspective, to see how not just very, very sick care, but preventive care, again, men's health, women's health, very specific targeted health, can be accomplished using those technologies. So
Yeah, absolutely.
yeah, definitely an exciting time. So any other
Nice. Sorry, my
thoughts
Zoom
on
slowed down for a quick second.
that?
Oh, sorry, I lost you for a quick second.
Am I still here?
It slowed down for a random second. Yeah,
Yeah,
yeah.
no, I
For
know.
some
I was
reason,
trying
there was a
to.
glitch in the
Yeah, can
matrix
you
for
hear me
like
now?
15
Yeah,
seconds.
I had no, I had low bandwidth.
Oh, okay.
Which is an interesting component of it also. So, the technology is only as good as when it works and when there's the appropriate bandwidth. And
Yeah, exactly.
certainly that's been improving over time, but still it is a little bit of a limitation. Um, so what are some of, yeah, I mean, some other topics within men's health, thoughts that you have, other than what we've talked about so far?
I think it's interesting is like so the hins and hers is like access to medications. A lot of this was predicated on seeing a physician, and there's certain physicians that will treat these kind of things, and certain people that are a little less comfortable doing it. Some more of the new like innovative strategies for like men's physical health and sexual health is fairly new, where it's least become it's a little bit ubiquitous now, but like 10 15 years ago it really wasn't. So like men doing TRT and different medications like that, that's a fairly new thing. People Men have been doing it for years and years, but kind of on a broad social level, it's a fairly new thing. And to have access to those type of medications and to manage it effectively and intelligently is something that's fairly new. But I think also the way we intervene on certain things is actually be really interesting. Um, you know, as medicine has kind of evolved, it's become less and less invasive. So everything that was cancer related, it was very surgical. It was very aggressive medications of platinum based chemotherapeutics, which had a lot of side effects. Now we're having monoclonals, we're having TCAR therapy. Eventually, now with the Lucid, is they're doing non-invasive strategies. We're looking at coronary artery disease, and so I think like a lot of our strategies are actually going to pull away from the invasive kind of things to be able to really better identify what options for treatment are best for the patient. We can be a little more specific rather than just purely sensitive in identifying those. I think that's really a lot of where the really cool innovation is going to happen. In terms of men's health specifically, this is going to affect men's health because cardiovascular disease is the biggest killer of men. But then, two, it's also going to branch out into other facets of medicine. So we don't have great care for like prostate related issues in men. Having TERP has its associated complications of urinary incontinence and erectile dysfunction. So it's definitely not benign. The medications don't always work that great. So it's a big thing is when you get older and you're waking up 5 times a night to pee and you can't sleep. And then, so these things tend to snowball themselves. So I think like access to different forms of treatment, less invasive forms of treatment, but they're also better, is going to be really interesting in the next 5 to 10 years.
Yeah, that's absolutely, that's interesting. There's another area that I'm thinking now that it'd be interesting to talk about briefly, which isn't specifically men's health per se, but it's very much related to areas like men's health in general. Is we're always talking about how the future of healthcare is becoming data, right? What we do with the data, how we manage the data, the kind of data that we're
Mhm.
collecting through all these devices, and again, unfortunately, not around much anymore. But it was 23andMe, but the concept of genomics versus phenomics data, and how are we as clinicians starting to use that information and as technologists to benefit longevity and preventive health and all of that. And it's kind of interesting because you look at the amount of data that's being collected, and again, we're talking about globally now. We're going to be able to, the predictions that are being made right now are that within the next 5 years, let's say you're 40 years old and you get a diagnosis of Hodgkin's disease, right? Well, in our current sick care system, it's a little bit like a dartboard, right? So, they make a diagnosis, you get a pathology diagnosis, you go to an oncologist, and they institute some sort of oncology regimen or care. Some of it is based on scientific evidence-based medicine, but it's not precision. It's not targeted for you as an individual. And well, and again, some people will say, well, what does that mean? Well, what that means is, okay, so let's start with the genomic aspect of it. Okay. If we've got a database, a global database of individuals on this planet, and we have their genomic sequencing, okay, we can start to identify there are going to be individuals across the globe who have similar genomic profiles. Okay. And not necessarily a DNA twin, but they have a similar profile. Well, because of that genomic profile, the way they're diagnosed and the way they're treated based on specific targeted pathology determines how well they respond to therapy. So if all of a sudden we have a database where you get Hodgkin's disease, you have a particular specific pathologic diagnosis, and we have a database that says, well, everyone, the 2% of individuals across the globe who have very similar genomic sequencing as you all responded this way to these treatments, and this is the best one. So all of a sudden, we're identifying a care regimen or a longevity regimen or a life prolonging regimen, which for your specific phenomic and presentation of your genomic profile was the best. Well, that's
Yeah,
a game,
absolutely.
right?
Oh, for
So,
sure. Yeah. I mean, some of it's already coming in too, because we have, like, therapies for like BRCA2 or the KRAS inhibitors, the JAK2 inhibitors. So some of that stuff is starting to come in and it has actually better outcomes. So we can do targeted therapy rather than the kind of old school way of these very broad-based chemotherapeutic agents. And, sometimes, potentially prolonging life and longevity and quality of life has actually improved with these medications. And just like you said, as we get information, more data, we start to create these kind of like machine learning biomarkers. We can actually identify things that we didn't see before based on a patient's, kind of profile of, vital signs, where they come from, their genomic factors, their past medical history, even things that we potentially haven't identified, and how those relationships exist, and we can create like a pharmacologic profile for them.
yeah, and I always, joke. My wife, who's a high risk obstetrician, we've joked over the years about this. I remember I came home once and we had 6 23andMe kits sitting on the kitchen counter, and I said, "What are those for?" And there was a reason for us to do it within our 4 kids. But I said, I'm not sure that I want to do that. And she looked at me. She goes, "Well, what do you mean?" And I said, "Well, at this point in time, I don't want to know about what I have a propensity to get, especially for certain, oncology, diagnoses and all that, if I can't do anything about it, right? It'll just make me more
Yeah.
anxious from a mental health perspective. But
Right.
if all of a sudden we have to have this database that we're talking about now that has both genomic, phenomic, and global implications in a precision way, if now it's not just sick care anymore, and it's not just making the right diagnosis and starting the right treatment, but what if from birth you have access to information that says, well, because we know that the phenotypic side of it is environmental exposure, it's what you do, how you live, how you conduct yourself. If all of a sudden with your genomic and phenomic presentation that you can do certain things to live longer and stay healthier, I think most people would be more motivated to do that once they have that information at their access, and there are databases that tell them exactly what they should and should not be doing moving forward. So that's a very exciting thing for me moving forward as well. It'll take some time, but not as much as we believe at this point, because of how quickly the technology is advancing. So
Oh, absolutely.
at the yeah, so we're getting a little close to the time here. So, what's one message that, you'd want every 35-year-old man, given all of that we've discussed and looking at this interview, to take seriously, that could change their life and extend their life?
Physician care, and just speaking from a clinician to clinicians, is one is the burnout issue is real. I think being able to kind of own your destiny, be able to take care for patients. I think the biggest like moral injury that happens with physicians is when we lose control, that loss of control, where like you feel like you can't do for patients what you need to. And then also is that you're being pulled by strings that are outside of your control, and they're not patient and physician centered, whether that's like crappy EHR systems or whatever metrics that you're trying to hit for a hospital that aren't always in the best interest of the patient. And so, making sure that you are taking care of yourself. But I also think that's why GHIN and GHIF and any of the physician run networks are really important, is that I think we have our input, is that it understands the issues and the optimization protocols that we need for physician and patient care. And the best way we can do that, it usually doesn't come from outside, but it really has to be the center of healthcare. So, and on top of that is like, maintaining that locus of control, but then also is like when you go home, take care of yourself too. It's like, we have maladaptive behavior just like everybody else. People get stressed out, they smoke, they drink, they don't exercise, we eat crappy food, and, because it gives us a quick little dopamine rush and we feel better. So just being cognizant of that and just to make sure that you take care of yourself, I think is really important. But then also stay engaged in this process. Like we need your voice, we need your expertise, we need your kind of applied science background to be able to stand all these programs so we can make it better.
Oh, so I think that's great. I think we've provided a good amount of information just as a background for anyone who's listening. Again, if you're a clinician, we encourage you to join Global Health Impact Network. If you just go to our site, www.globalhealthimpactnetwork, you can join as a clinician and participate in the areas that you're most interested in from an innovation perspective, whether it's specific to your specialty or whether it's specific to your interest areas. I'll even, share here for a second, and I can show people just a quick view of our hands-in network. That would be kind of fun too here for a second. So let's see. Can you see my screen now, Lee?
Yeah, it's about to pop up, I think. We'll see. Not quite.
There we go.
Oh, here it
Your
comes.
screen sharing. It should be coming up here in a second. Okay. Can you see it
I can
now?
see myself.
Okay, great. Yeah, so
Oh, here we
how
go.
about now? There
Yeah,
you
it
go.
looks like the screen's coming up now.
Okay,
There
so
we
this
go.
is our network.
Perfect.
You can see this is built on our proprietary hands-in platform that we use, and you can see our network here. When you go to the network, again, we have a series of communities, over 400 communities, and longevity is one of the communities in here. You can, as well as a lot of the Republican but private communities, general communities, ways to introduce yourself to the rest of the network, which is global. So it's a real opportunity. So, we encourage you to join us there. And yeah, I'd like to thank you, Lee, an incredible member and partner, on the venture fund and on the expanding the network. And I look forward to having some more events like this with you here on GHIN. So thank you.
Yeah, no, this was great. We should definitely do this again. I look forward to the next one.
Yeah, absolutely. All right. Thank you.